First at 4, coronavirus vaccines are supposed to be free of charge, but patients who don't have insurance are still concerned about getting a surprise bill in the mail. Eyewitness News reporter Mariah Medina talked to the local health authority about your rights.
Texas leads the nation in uninsured adults, so as many seek care to prevent and treat coronavirus, many may be wondering, will I get a surprise bill? In most cases, no.
The doctor's offices or any other provider administering this vaccine cannot charge people receiving this, regardless of their health insurance status or their immigration status. So at COVID-19 vaccine providers, they cannot charge you for the vaccine. They cannot charge you directly for any administrative fees, co-pays, or co-insurance.
Dr. Anita Kurian is the Assistant Director of Metro Health. She says providers can bill you for an office visit if you get other medical services outside of the vaccine.
If the only service that was provided during that office visit is your COVID-19 vaccinations, the provider can seek reimbursement from the health insurance companies, be it your private or your government insurance companies, for a vaccine administration fee.
The CDC says providers can't require you to receive other services in order to get the vaccine, and that they may not bill you directly, insured or not, for the vaccine or administrative fees. You can report suspected violations to the Office of the Inspector General at tips.hhs.gov or by calling 1-800-HHS-TIPS. Dr. Kurian says while she hasn't heard of any area providers charging, the health authority did see schemes with the sale of unapproved COVID-19 tests at pop-up shops. She's urging caution.
Bottom line, you have to be cautious.
Mariah Medina, KENS 5 Eyewitness News.